Dear friends, in this video, I'm going to show you a case of posterior polar cataract with a pre-existing posterior capsular rent. You can see a dense posterior polar cataract with some faint lines behind it, and those are the lines of the posterior capsular rent. I normally do the rexus through the side port. I prefer this technique because the anterior chamber remains stable throughout your procedure and you don't have to refill the anterior chamber multiple times with the viscoelastic substances. I have completed the rexus successfully and I'm planning to do a hydrodelineation in this case, and I'm avoiding hydrodissection as there is always a fear of extension of the PCR. Now multiple areas I'm using small fluid injections at multiple points so that the nucleus gets separated from the epinucleus. Again, I'm using a viscoelastic to separate the nucleus from the surrounding epinucleus. In this case, I'm using a Centurion FICO machine. This is a wonderful FICO machine and the stability is wonderful, especially in cases like this where you are expecting a complication and you want a stable chamber throughout your procedure. I'm using, in fact, very minimal FICO power. This is almost in an epinucleus mode. I'm just trying to tease out the nucleus out of the bag and using very minimal vacuum trying to aspirate the nucleus. I have not rotated the nucleus because of the fear of extension of the posterior capsular rent. Once the nucleus is out, you can see the epinuclear plate. I'm using viscoelastic substance to separate the epinucleus from the posterior capsular bag. Care taken not to over-inflate the bag. Just extending the side port and the main port because I'm planning to put in a 3-piece foldable intraocular lens in this case onto the sulcus and planning for an optic capture. I normally use a bimanual technique. This is more convenient in such complicated cases. In this case, what I'm planning is to tease out the cortex from all around 360 degree, but retain the central cortex and the epinucleus as such in order to avoid any extension of the posterior capsular rent. You can see I'm just pulling out the cortex from the sides, but I'm using the irrigation port to tease out the cortex that is aspirated from the aspiration port so that it is just released out. Once all sides it is removed, now I am continuously aspirating it in a very slow manner so as to avoid dropping of the cortical matter into the vitreous through the PC rent. The procedure is done very slowly. There is no manipulation, unwanted manipulations done inside the anterior chamber. You can see the whole cortex has come out. Now there is a small piece at the 12 o'clock position. What I am planning to do is remove the aspiration port, retain the irrigation port and push in viscoelastic before removal of the irrigation port. This is to avoid sudden collapse of the anterior chamber which may extend the posterior capsular rent. Now I am switching over the hands to other sides and I am trying to aspirate the 12 o'clock cortex, that is a small fluffy cortex that is there. That has also come out. Now again the aspiration port is out and retaining the irrigation, I'm again pushing in viscoelastic and thus inflating the bag. More viscoelastic to fully inflate the bag. Smearing the cornea also with the viscoelastic in order to avoid any drying of the cornea. Some more extension is done because I'm planning for a 3P foldable intraocular lens, and 3P's foldable intraocular lens introduction is always a little tricky if you don't take precautions. So I'm using the spatula to stabilize the globe, and once the nozzle is inside, slowly pushing the haptic, and now it has gone over the rhexis. Some more visco goes into the eye. Now with the side port, through the side port, using a Sinskey hook, slowly dial it into the sulcus. Now just tap the central area and the optic goes underneath the capsular rhexis margin. I always hydrate the main port before the viscoelastic substance is removed. Using a bimanual IA, in the visco mode, I am aspirating all the viscoelastic that is there in the anterior chamber. These kind of cases, it is better to avoid going underneath the optic of the lens and aspirating the visco. Once all the viscoelastic is aspirated, again the irrigating port is maintained in that same position. Aspiration port is removed, and I hydrate the side port before removing the aspiration port. Hydration is done. Now you can be careful. You can make sure that only one port has to be hydrated because rest of the ports are already hydrated. Make sure that the anterior chamber is well maintained. In these cases, I normally use intracameral pilocarpinol so that the pupil constricts, and this in turn creates a backward thrust which maintains the intraocular lens correctly in the position. You can see the pupil is slowly constricting. See, now you can very clearly see the posterior capsular rent like a cat's eye, and that is not extended at all. The whole manipulation has not disturbed the rent. That's the beauty of this machine. Thank you.